All righty, let's see if we can get this show on the road. We'll see if we can get everyone out of the waiting room and here into the session with us. Hope you're having a fabulous day. I know that as we get started today, that this is a great time and kind of a new beginning as we get ready for the VIP class that we're starting up each quarter, talking about everything you need in order to pass on test day. So as you get tuned in, if you wouldn't mind, head over to the chat box, give me a quick sound and video check, make sure that we're broadcasting loud and clear. Plus, you should be able to find the slide deck for today over on the page where you found the live webinars. You can find that. I will also post over in the chat box the the Dropbox link so you can see and take notes if you wish along with me as we go through today. So I'm going to go ahead and post that over in the chat box. So if anyone who tunes in a little bit later, if you wouldn't mind, someone can help me out over in the chat box and just paste that link again so that everyone can have access to the slide deck if they wish. But I'm excited to get going today. I know that it's a big task getting ready for test day, and it's always fun. So as we get tuned in, while you're getting logged in, getting the cobwebs dusted off, please, would you mind telling me where you're tuning in from? It's always interesting to see where everyone's tuning in from. I'm broadcasting to you from the great state of Idaho. Any of you who've ever been to like Yellowstone National Park, kind of in that general region near Yellowstone. But I'll introduce myself just a little bit later as we get started here. But let's just go ahead and talk about this class. I know we've got a lot of guests here today. So this is the VIP class. This is the start of my VIP program, which I run every quarter. It's always fun to get lots of people from across the country. We've got folks tuning in from New York, Charlotte, Searcy, Arkansas. We've got Oregon. We've got Idaho Falls. Yes, I always love a little Idaho representation. New York, Iowa, Cleveland, all over the country. And in fact, all over the world. We typically get folks tuning in internationally as well. So as I mentioned earlier, my name is Will, and I am a PT. I started PT final exam in 2012. So we've been in business for about 11 years now, helped somewhere north of it's probably close to 20,000 students pass the exam now. So it's something I feel very confident I can help you get across the test. I've got a family, I've got 4 kids, and we live in a very, very rural part of Idaho. So any of you who've been to Idaho, you know there's a lot of rural country out here. So I worked in a critical access hospital for about 8 years. I was the rehab director there for a little while. And so I got to work in all kinds of settings. I got to work inpatient, outpatient, nursing home, orthopedics, pediatrics, sideline care at events like football and basketball games, home health care, pretty much wound care, pretty much the whole spectrum of care, everything except for, say, like level 1 acute trauma victims. Everything besides that, I had a pretty well-rounded experience. I am orthopedic certified. Any of you who are planning on going on to get your orthopedic certification specialty license, we can talk about that sometime during the class as well. But the goal today is to, number one, talk about resources that you have available. One of them is the NPTE podcast. This is totally free. It's a great way to go through content during your commutes as you're going on a run or washing the dishes or whatever it is you're doing. You can check that out, totally free. Find it on Google Play, Apple, iTunes, Spotify, wherever it is you listen. The VIP program, I know we have a few guests here today, so just a quick note about the VIP program. VIP program, this is meant to be a small group study. It's meant to be an area where you can get your questions answered. We meet twice a week to go over practice questions. In fact, that's one of the most fun things we do as a part of the class. And we'll do that today. We'll go over some practice questions together, really try to hit the content in a very effective way. We try to stay organized as we go through each system. It's very robust. We've got a full video library of content for all the major joints, the major diagnoses, all the things that are most likely to show up on the test. And then the other thing that I get a big kick out of is doing the one-on-one phone calls or power calls that we do together. This is where you schedule a time and you talk with me about content, about test strategy, about anxiety, you name it. We can chat about it. You can schedule those as a part of the VIP program. I don't specifically limit the number. However, I do recommend that we schedule 1 or 2 of those to begin. And then after we finish 1 or 2, maybe we can schedule another 1 or 2. I just want to make sure we've got time for everybody as they're trying to schedule around their schedule and my schedule and all that. But it's a lot of fun. We get to do things on a very, very small group style. It's a very, compassionate, proven, effective learning strategy. And I think you'll really enjoy it. So any of you who are on the fence, please feel free to message me. you have any questions about it, be happy to have you in the class. So today our plan is to talk about the NPTE blueprint. So really the goal here is to talk about what's on the exam, how it's developed, what the structure is. And the biggest thing is really those effective study strategies and practice questions to make sure that you know precisely what's on the test and how to prepare best for it. So we'll talk about, for a minute here, we'll talk the mechanics of the test. Again, probably most of these things are fairly familiar to you. Hopefully a little review doesn't hurt as we talk about what will precisely be on the test and then talk about how to prepare for that. All right, so for 2023, there really aren't any major changes. The last major update they made was in 2018. They did do some small updates in 2020 as well. For 2023, they just carry on those same updates where they have the lymphatic system, very specific 3 to 8 questions related to the lymphatic system. Definitely have to know that. Gastrointestinal system, that was something that was updated a few years ago that now you are guaranteed to have somewhere between 0 and 2 questions. So it could be zero questions about GI. This is about examination specifically. Up to 2 questions about GI examination, a small reduction in musculoskeletal content. And then the biggest thing that really is key for 2023 are the video questions. So the video questions, we'll go through some examples of those in the class, but the video questions are meant to be brief. There's no sound to them, and you have to analyze the video. And I'll talk about, on Thursday, we'll talk strategies about how to analyze video questions to try to get to the heart of what it is that it's asking you. But video questions might be the most unique thing for 2023. There's always image questions. So they always had still image questions, but videos. And then you don't have to worry about it. But in 2024, so next year, they're planning on implementing story or case-based questions where you'll have a case, like a paragraph of information, and then you answer 3 or 4 questions about that case. But that, you don't need to worry about that. That's for 2024. But just as an FYI, any of you who are targeting down the line a little bit, watch out for those. And then certainly the video questions. All right, so just by raise of hands, so in Zoom, you can raise your hand if you want. Just by raise of hands, how many of you are familiar with the FSBPT content outline? So the FSBPT content outline, this is the description, it's the numerical, the quantitative analysis of the precise number of questions in each section on the exam. Now, the thing that's most important here is you'll note the big 3 systems, cardio, musculo, and neuro, are certainly highest on the list. So the musculoskeletal system, that'll be our first or primary focus as a part of the class, is that somewhere around 60 questions related to the musculoskeletal system. Neuromuscular, close second with about 50 questions, and then cardiovascular close behind that. And then that's when you get into the other systems, the system interactions, gastrointestinal, genitourinary, all these things we talk about as a part of this class, the VIP class. And then the non-systems, I've got a bunch of stuff about that as well. We'll go through a bunch of practice questions. And this is the one, if I had a nickel for every time someone asked me a question about the NPTE, it would be because they were asking about interventions, is always the most tricky one, and the non-systems. So we try to really hit those as a part of the test or part of the class so that you can just rock it on testing. That's the key. Yeah, so it's definitely worth having some familiarity here. The other thing that I like to say about this is you need to study proportionately from this content. So that just means that as you look at the big 3 systems, you say to yourself, all right, that's about 75% of the test. Therefore, about 75% of my study time should be in the big 3 systems. So cardio, muscular, neuro, and then not to forget the other items or the other systems on the test, but just make sure you've got them. All right, so this isn't as applicable as it was, say, 2 years ago in 2021, 2022, certainly 2020, but COVID-19 still has some ramifications when it comes to prometric centers. It is regionally dependent. So depending on what your region is, they could still require possibly some masking, but more than likely they have some extra sanitation procedures in place because you do have to palm print or fingerprint in and out. You've got to sit in all the same chairs. And so it just takes longer. I guess that's the moral of this story, is that it is a lengthier process. So just be prepared for a lengthier check-in and test experience than you may otherwise have had. And I think that just mostly just a little mental preparation there, that when you get in there, it's just going to take a little extra time to get you checked in, get you ready, get your computer station sanitized, whatever. It just takes some time. And you may want to check to see if your center is still requiring masking. If I'm not mistaken, most have pretty well stopped. But if they do require that, and especially if you wear glasses, so corrective vision eyewear, you'll find, and not that this is any news to you, but the mask can cause fogging up of your glasses, which would be very annoying on test day. So you just want to make sure you know exactly what's going to happen on test day. And the best way to do that is just contact your local Prometric center or check out their local site to make sure that that is either not an issue, or if it is an issue, make sure you are prepared for that. All right. So as far as what's on the test, we already talked about the content outline, and this is an FYI, in case you're wondering how they decided to put that number of questions on the test. What they do is they do a practice analysis every 5 years, and they just completed the last one. So the practice analysis is really just looking at what do entry-level PTs need to know in their first year of practice. And so that, combined with the textbooks, leads nicely to the content outline. So it's what you need to know, and the textbooks that are used by programs, what you're likely to know. So what you need to know, what you're likely to know, and that combines nicely into the content outline. So it's not rocket science. It's just entry-level practice. It's what you will experience as a first-year PT. So when it comes to the development, this is really just kind of again, the more you know about the test, the less anxiety you'll feel. And that's really just because the more we know about something, the more in control we are. And so as far as what's on the test, it's entry-level practice, current content in published textbooks. So you don't need to worry about the most recent research article. This is why, for instance, dry needling will not be on the test, because it is not in any current textbooks. It's not part of the standard curriculum. It requires additional certification to get certified for dry needling. So therefore, it's not just unlikely, it will not show up on the test, because it is still relatively cutting edge. Dry needling, it's cutting edge, whereas some of the more standard protocols, so like stroke management, proprioceptive neuromuscular facilitation, all those are core material in the core textbooks, and it's going to show up on the test. So as far as who actually writes the questions, I always thought this was interesting when I finally learned it. Who writes these questions? Well, the questions are actually written by a very diverse set of writers across the country and across the practice spectrum. So every region of the country, they get volunteer item writers. This is the Federation of State Boards of PT. They get the item writers to volunteer, and before COVID, what they would do is they'd fly all the item writers into Washington, into Alexandria, Virginia. And from there, they have a big library of content, and they'd have all the item writers come in, and they'd spend 2 or 3 days writing draft questions. And they'd have the process is just they have a big library. They pull the book off the shelf, they set it on the table, they open it up to something that they have some proficiency in, and they write a question about that textbook paragraph. So really, the questions come directly from PTs, practicing PTs, coming from core textbooks. And that should at least give you a moment of maybe a little bit of assurance that it's not not cutting edge. It's not way out left field content. It's not a group of suits in Washington making the worst questions possible. I actually had a CI who was a volunteer item writer. So these are actually people that you probably rub elbows with all the time. And so in any case, that's where the first draft comes from. Then it takes about 2 years for each item to eventually be developed into a question. Goes through about 8 different editing processes and committees. Then finally, each item is rolled out as what's called a pretest item. And we'll talk about some myths about the pretest items. But the pretest items, these are items that they have been written and now they need to be validated. And so they show up on your test as a non-scored item. So every one of you, as you take the NPTE, you'll have a pile of pretest items, these not quite yet finished questions. They need to be validated by you, and then they're then further analyzed via what's called item response theory. But they have a very, not to go to bat for FSBPT, but it is a very lengthy and robust process to get a question approved for the exam. So on test day, you can expect 200 questions plus 200 plus 50 unscored pretest items, making your grand total 250. Now, one of the myths about these pretest items is that there's some way to to find them. Maybe they're all in the last section, the last 10 of every section. And that is all untrue. The pretest items are totally randomly distributed throughout the entirety of the test. So you have no idea which ones they are, and you just have to answer every question as if your life depends on it, because quite literally it could. So therefore, I mean, mathematically speaking, they do put 10 pretest items in each of the 5 sections, but they are randomly distributed. It could be the 1st, the 5th, the 15th. It's totally randomized. And then another thing that's interesting is that on test day, there are a bunch of different forms of the exam. So this is just to prevent cheating. So that if you're sitting next to your best friend from PT school, you sit right by each other, but you'll take 2 totally different forms of the test. And again, I tell you that because I've had people come out and say that, oh, there were so many developmental milestone questions, and your friend will say, I didn't see any of those. And it's because you took 2 different forms of the exam. And then each item is only used once or twice before it's retired forever. And then the grand total is $250 for PTs, $200 for PTAs, following similar proportions. So that's our grand total. The sections, now on test day, you'll get 5 sections of 50 questions each. These are not adaptive questions. The questions, it's a straight block of questions. You take from 1 to 250, a straight set. There's no adaptive nature to it. So that's good, because I believe the nursing test is like that, where as you answer questions correctly, they give you harder and harder ones, and then the test will stop once they feel like they have enough information. That is not the case for the NPT. The NPT is just a straight set, 250 items, and you have to just do your best on all 5 sections. So test day, again, most of you probably know this, but on test day, you get 5 hours. This is standard time. I know some of you have accommodations, so time and a half or double time, but standard time is 5 hours for the 5 sections. So that stands to reason you'd have about 1 hour per section. Now, you can use your 5-hour bank as you wish. You could use all, 4.5 hours on the first section. They don't care. They just give you the 5-hour bank to use as you wish. My suggestion, as you'd imagine, would be to target 1 hour per section. And so if you want the exact timing, that's 72 seconds per item, but that's not very reasonable to calculate that while you're on test day. So my recommendation is 1 hour per section, or a half hour per half section. So that means after the first half hour, you should have completed 25 questions. The first hour, you should have completed at least 50, hopefully more within that first hour. You are permitted to take what's called a scheduled break after section 2. So that scheduled break, that's the bathroom break. It's where you get a mini timer for 15 minutes. So 15-minute timer. 15 minutes for this scheduled break after section 2. And this is the same for PTAs, by the way. After section 2, you get that 15-minute break. And I encourage you to at least visualize what this break will look like. That's really, it's going to take a few minutes to check in and check out. They have to take your picture and palm print. They want to make sure that you're not switching with somebody. And then you ostensibly probably will use the restroom, get a drink of water, access any food or medications that you brought. And then you'll return to your seat, and you have 15 minutes to do so. So when I took the test, like one of the things that I did, I went out into the lobby and I walked up and down the stairwell for like 3 or 4 minutes. It certainly was not a big exercise routine, but it was something to get the blood flowing so that I would be awake and alert for the next section. So you could consider something like that. I've had people do stretches on the floor, people do push-ups, really anything to get the blood flowing and get your brain woken up again so you can dive into the final 3 sections. You are permitted to take what's called unscheduled breaks between any of the other sections. So any of these other sections, you can take an unscheduled break. Now, these are what I would consider the emergency bathroom breaks. It is the clock does not stop for these. And so any moment you're out of your seat, it's a moment taken away from your test experience. And so therefore, you'll want to use these very judiciously. And in fact, I would argue that most of the time you probably won't need it. The only time that it could really come into play is if like you over caffeinate in the morning. Caffeine is a strong diuretic. And so if you over caffeinate or overhydrate, you could possibly need an emergency bathroom break. In any case, you don't plan on using these, but they are there just in case. But each section must be submitted. It's almost like each section is a standalone 50-question test. So once you complete each section and move on, you cannot return to it. So again, it's just divided up into 5 sections, 50 questions each, so you can take breaks. On the test, you are permitted to strike through or mark items as you require, as you wish. My big advice here is only mark items very judiciously. Mark them very judiciously, because if you go and mark every item to return and review, you'll find that it takes forever to come back and return and review it. Now, striking through the item, it doesn't have any effect on your scoring, but it can be helpful as you look at the item and you say, okay, that's clearly incorrect. You can strike through it so you don't look at it and then look through. It narrows your answer options. Again, it's for your convenience. So use it judiciously, I guess I should say. I mean, you can strike through all you want, but just don't waste all your time trying to figure out what to strike through and how to strike through everything. And then we will talk about brain dumping. One of the fun parts about the VIP class is that we will do a brain dump session right before test day. We will actually talk about what you could put on your brain dump. Brain dump is just your scratch pad. You get a scratch pad. Usually it's a dry erase pad with a dry erase marker, and you can jot down notes, calculations, your acronyms, mnemonic devices. And we'll talk about some of the things you can put on that. Usually we do that the week before test day. So that's, again, another great benefit of the VIP program. We get to do a bunch of brain dumping together. So how do you pass the test? Well, to pass the test, you have to have a 600 out of 800 scale score. Those of you looking at the math, you're saying that's 75%, right? Well, the truth is that the score, the actual raw passing score, has been somewhere around 137 in recent years. So those of you looking at the math, you'll say to yourself, oh, that's about a 68%. So somewhere around a 68%, 68.5% is the threshold bar for passing. So generally speaking, I get asked this question all the time. Will, what should I target on my practice tests? And then usually I say a silly answer like, well, you should target 100% on your practice test, right? And they say, no, that's not what I mean. What is the passing threshold? And so the passing threshold is about 70%. So the higher above 70 you get, the more likely it is that you'll pass the test. And so on test day, you can expect to require about 68% to pass. So that's why I like to see that 70% cutoff as your passing threshold. It is the same for every state, just as an FYI. I still get this question occasionally. Like, is it different if I test in, say, Arkansas versus Idaho? And it is not. It's the same. Every state is governed by the Federation of State Boards. Exam scoring is done electronically, automatically. There's no penalty for guessing. Occasionally, you get a score withheld, and that's only if you had a strange answer pattern or if you have an unusual score increase. A lot of times that's from taking a nice VIP class like ours, where you can get a giant score jump if you have a previous attempt. But usually it's if you have an irregular answer pattern where either there was an incident at the site. Like this last time, this was a little bit disturbing. I had 2 people say that the computer glitched out on them and auto submitted before they'd finished the 5th section. So they had to fill out an incident report, and I'm still waiting to hear how they are going to resolve that. But chances are the test center, they'll probably make them test here in either the next coming weeks or possibly even wait until July. So again, that's why they make you wait at least a week before they give you your score. And even though it's done instantaneously, like when you walk out of the test center, they know your score, but they won't release it until 1 week after your test experience. There's no penalty for guessing, so be sure to put down your very best guess, because that you may as well take a stab at anything so you can possibly get it correct. All right, just a few myths here. And if you do have any questions about any of this, please be sure you can use the chat box, use the Q&A feature. So Zoom has a nice little Q&A feature if you want to queue up a question for me, always very nice. So a few myths. So this is a myth I get all the time. Is the test harder in July and easier in January? So those of you here today targeting the July exam, I'll tell you, more people fail in July than fail in January. And that's where this myth arises, is that there are literally more people fail in July than in January. That's only because more people take it in July than take it in January. That's because of the spring graduation dates. A lot of you are probably experiencing the same thing. You just graduated here the first couple of weeks of May, targeting the July exam. And so that being said, the test is exactly equal July versus January. It's just that the pass rate stays the same and more people taking it. So the pass rate current first-time pass rates are somewhat dependent on a few factors, but generally speaking, the pass rate is around 89 to 92% first-time pass rate. And so, like in my PT school, we had 40 students in our class, and that was sobering to think that 4 of us were likely to fail the test. And so, just statistically speaking, it behooves you to not be a part of that 10%, behooves you to be a part of the passing percentage. And again, that's why you're here as a part of the VIP class, to push you through, get you through the test. 800 out of 800 does not mean you answered every question correctly. So a perfect score really just means you scored about a 92%. And really what that means, they just stopped caring. They said 92%, okay, fine, got an A on it, 800 out of 800. Another myth is that there are multiple correct answers to each question. That is incorrect. I wished I had told myself that, like looking back when I took the test, I came through the test thinking, oh, there were a few of those that there had to be multiple correct ones. But the truth is, and we'll talk about this especially more on Thursday and then throughout the class, there's always one correct answer, and there's a strong reason why. A lot of times it's the order of operations, it's safety for the patient, it's considering all of the aspects of the patient or the caregiver. Just begin every question with the mindset that there is a correct answer and you can find it. And with that in mind, you'll save yourself a lot of emotional energy and get the question correct more often than not. The FSBPT, again, not to go to bat for FSBPT, but are they out of touch with reality? Well, the FSBPT, these are just your peer PTs. So they're from across the whole country, practice spectrum, you name it, very diverse set. And that's the practice of PT. So yeah, it's meant to be current published textbook and current practice, and that's what's on the exam. And then finally, this is a kind of a fun discussion. Is the test academic or is the test clinical? And the truth is, it's kind of a Venn diagram where it's the intersection of both, where you have the academic and the clinical. And really, each question is written in the form of a patient case. And so with that in mind, it is technically clinical, but every item is written straight out of the textbook. I mean, it is legit the academic application or clinical application of your academic skill. They take it straight out of the textbook. So is it academic? Well, yes. Is it clinical? Well, yes. So it's the intersection of the two. So a question comes across the Q&A box. It says, during the exam, is it okay to do movements of your arms or lumbar spine when you're figuring out questions, or would the test center not allow that if it's, say, too distracting? So the short answer is yes, it is okay to do movements. The longer answer is that it's not okay to like reach over and accidentally hit your neighbor or disturb anyone else in the test center. So for instance, if you're working on, say, hand, if you're looking at what is the position of greatest grip strength in your hand, you say, oh, well, the wrist extended to 30 degrees. And so doing a wrist grip strength exercise while you're sitting at your desk would be absolutely permissible. What would not be permissible would say to be do the near test and you're like waving to someone across, or perhaps is distracting, or you're not permitted to stand up and walk and do like a gait deviation. Again, that would be ill-advised. So things you can do discreetly while you're sitting there without disturbing anyone, totally fine. If it looks like a hand signal that you're like waving to or giving some kind of cue to someone else, then, or if it's even disturbing to someone else, then it's ill-advised. So how's that for an answer? Everything small and close to you, you can do really without any trouble. Excellent. Any other test questions or test-related questions? And we can certainly bounce back and talk about that. So what I'm going to do now is just do a little course orientation. Again, we have most of you here are a part of the VIP class. A lot of you are thinking about being a part of the VIP class. I'm just going to talk about some of the mechanics of the class, and then we'll finish up with some practice questions. So we'll talk about some strategies and practice questions still, but just a little orientation to the class. So the class is run like what you would consider a good university course. So we have classes, we have assignments, we have content available to you. It's really very robust when you consider all of the material that is available to you. Full video library that you'll go through each week. We have live sessions like what we're doing here, going through questions together. In fact, we focus primarily on practice questions. You have access to me to contact me if you have any questions. We do one-on-one phone calls. You have 6 practice exams, and then complimentary access to our crash course, the 3 weeks right before test day. We hit cardio, musculo, and neuro one more time. So again, we cover all the bases between recorded content, live content, one-on-one content, practice exams, and then cramming or review content right before the test. My big mantra has always been to give you the right content, but also give you it at the right time. And so that's what I really want this course to be, the right content at the right time. So talking about some of the class, just a few things about the class. We already talked about the exam. We have, a lot of university programs are partnering with us, and we do remediation for every jurisdiction that requires remediation. We can do that as well. We have PTs and PTAs, really very, very robust in every way. So as far as our course here, this is what we're going to do. We've got the live sessions. We have a lot of pre-recorded modules. We have the written workbook. I'll talk about that here in a minute. Practice exams, crash course, and then we talk about test day strategies as well. So we go everything from content to delivery or execution on test day. So as far as where we meet twice a week, and like what you're experiencing today, we meet twice a week and go through practice questions. Each week, I give you assignments out of the workbook. And so the workbook is really just meant to be an active learning style, active learning. If you want a printed copy, I can ship you a printed copy, but the workbook, this is the printed copy of it. You have the electronic version you can download and fill out electronically if you want, but it just goes through each system, has all the key bits you need to know. It's all in table format, so you can fill out tables and bullet points. It's meant to keep you organized. I just talked to someone very recently that their biggest thing they told me was, Will, I've got like 1 million flashcards, and I don't know what to do with them all because I can't find them. They're not organized. So the workbook is a great way to stay organized. And if you do want a printed copy, just message me. We've got the private Telegram group you can access as a part of the VIP class, or you can email me and I can get you that workbook if you want the printed version of it as well. And then, so each week I give you an assignment out of the workbook. It's really just each system. So this next week, it'll be the musculoskeletal system. And the goal for the week of MSK is to just go through all the MSK content, the workbook. And that's reflective of what's actually on the test. So each main session we go through, I target about 90 minutes. Sometimes it takes a little longer, a little shorter, just depending on the content. But I do record everything. So like today, I'll have this recorded and posted hopefully within about an hour. I get those sessions recorded and posted ASAP. So as far as what you need to have access to as a part of this class, mostly just access to your core textbooks and a computer. And between those two things, you can get pretty much everything else done here. Like I said, I've got 6 exams that are available to you as a part of the VIP class, plus the crash course. We'll do some cramming as we go through as we get closer to test day. The workbook, as I said, it's not a busy work assignment. At least I hope you don't ever consider it busy work. It's a good way to stay organized and to see just the breadth of the content so that you can stay on task. So you know exactly what it is that will be likely to be tested and what you need to work on. All right, let's see. Question says, does the printed workbook cost extra? Yeah, it's $35, and that's the print and shipping cost. So if you want the printed copy, $35. I think last time I priced it out for a single print, I think it's close to $70 if you just go print it at Staples, because it's like almost 400 pages. And I like spiral binding. I do everything spiral binding so it lays flat when you open it. So if you do need the printed copy, can definitely help you out there. Let's see, a couple of questions. There's a couple other questions in the Q&A box. I'm going to hold those for a little bit while we go through the mechanics of the class, just as an FYI. That's the workbook. Each week we go through a different bit of the content, and then just a way to stay organized as you go through everything. As far as how to communicate with me, the easiest way is to communicate via the Telegram group. So Telegram, it's a free phone app, and over in the course dashboard, you can find the link that'll take you to our Telegram group. If any of you have any questions about finding that, you can email me directly and I can help you find that as well. But that Telegram app is very, very helpful for it's a great way to do instant messaging, a great way to communicate with your other classmates if you wish. We can do private messaging there. It really is fabulous. It's also a great place if you find a question that's very tricky. just snap a picture of the question, say, hey, I'm having trouble with this question. Anyone have some thoughts here? And it's super helpful. It's a lot of fun as a part of the class. All right, content outline. We already talked about this, but study proportionally. And I try to make the assignments mirror that content outline. That's precisely what we're after. As a part of the test, or part of this class, you get access to 6 exams. And I need to update this. We have 6 exams, but there's a bunch of other exams. The PETEs are fabulous exams. They are for additional purchase from FSBPT, but if you need more tests, the PETE exams are fabulous. They can get you through a lot of content really quite quickly. Other resources, be sure to use your textbooks, school notes, review guides, study guides. When you're doing the workbook, this is more just a pro tip. Don't just copy and paste from the internet because it doesn't stick that way. What actually sticks is when you put it in your own words. And we'll talk about some of those study tips coming up here in just a minute. So I think I did want to talk about 1 or 2 other things here. If you want to schedule a call with me as a part of the VIP class, you can schedule calls with me. You just go into the course dashboard, schedule a power call, and there's a Calendly link that comes up, and you can schedule a time that works for you. And we do these as needed. I don't specifically limit the number, but I do recommend you schedule 1 or 2. We will complete those 1 or 2, and then we can go for another 1 or 2 just to make sure that we have give everyone enough time. So like sometimes I have had to go and change the schedule if someone like books 50 in a row. Like, okay, that's not the purpose of the call, and it takes up all the time, so other people don't have time. So yeah, schedule those 1 or 2, and then we'll go through another 1 or 2 as a part of the one-on-one power calls. And then the other thing is I just want to make sure you get your questions answered. So when you do ask a question, make sure it's a good, well thought out question, meaning that, it's not, because I have had some people say, hey, Will, tell me about EKG. Like, well, what do you want to know about EKG? That's quite a broad topic. So be specific in your questions, and we will do our very best to help you out all the way, because I know it's stressful getting through everything. Absolutely stressful. All right, I have a slide here about the practice exam, but that pretty self-explanatory. There is a tutorial there. It'll tell you everything about how to access the test. All right, so let us see. We got a couple other questions. Tisha says, is it best to take a practice exam each week versus every 2 weeks? That's a great question, because I recommend, as far as when to take practice tests, I recommend taking a test every 1 to 2 weeks. And the reason I say 1 to 2, I give a range, is because some people will have a great number of tests available and time available to attack those tests. So you could ostensibly take a practice test once a week. Most people, as far as schedules and the quantity of tests available to them, tend to be on the 2-week range, meaning they take a full practice test about every 2 weeks, because it's a full 4 or 5 hours to take the test, and then you have to review it. It just takes a lot of time. So generally speaking, I recommend a practice test every 1 to 2 weeks, As far as the practice exams go, another question says, can we take them more than once? Yes. So in our exam simulator, you can reset the tests and take them as many times as you wish. You can build quizzes based on the body system you'd like to target. And so again, try to make it as convenient as possible. And then there's a question about what's the email address to order a copy of the workbook? Just admin@ptfinalexam.com. And I'll put that over in the chat box as well. So if you need to directly order the printed copy, like I say, $35, and that includes shipping. So it's the print and ship cost. Really, it's just it's my net cost of what it takes to get that thing out there. Let's see. Sonia says, is there a structured syllabus with due dates so we know what coursework to do for each week and what we need to have it done by? Yes. So the syllabus that I have posted as a part of the class, the syllabus will list by body system, and then each week there is a chapter of the workbook that is that body system. So for instance, the musculoskeletal section starts on page 43. It goes through, I can't remember, it goes through page 43, and it goes through like page 100. And that is the assignment for the week of musculoskeletal. So musculoskeletal week, it starts next Monday. And so ostensibly you'd finish all of musculoskeletal content from Monday to Monday. So that's how the syllabus is scheduled. And again, everyone's schedule is a little bit different. So I don't break it down by day necessarily. So Monday, I have to do this, Tuesday, this. Because like I just talked to someone today, we got a temporary license, they're busy, and they have time on the weekends, or they have 1 hour on regular day, weekdays, and more hours on the weekends. So I like to go week by week as a general paradigm. I question, what days and times are these weekly sessions? They're Tuesday and Thursday at this time, the 3 p.m. Eastern time slots. And you can see all of that on the course syllabus page, the sign up page, the course dashboard page. So I try to post that as many places as I can. As a part of the class, you also have access to my study guide. So I've got a study guide. Again, if you need a printed version of it, but you have the electronic version that's automatically included, no extra cost. The study guide, it's a great way to look for content. If you want to look up, special tests, range of motion, you fill in the blank, you can find it. It's all PDF format. And so you can search it very, very quickly, which is a lot of fun. All right. So as far as your time goes, I do recommend most days to get somewhere between 2 and 4 hours of study time in. So generally speaking, 2 to 4 hours most days is going to get you through an adequate amount of content in the amount of time that we have between now and the end of July when the NPTE will be. So that being said, if you graduated a very long time ago, so more than say 6 months or 2 years ago, because I get people, like I had a lady, she passed the test. She lives in Hawaii and she took her test she was 73 years old and had graduated before I was born. And so it took a lot of time to go through all the content. And so in her case, she took a lot of time. But that being said, I do recognize that there is a difference in quality of time. We'll talk more about this, but a 12-hour session, sometimes a 2 to 4 hour session can be better than a 12-hour session of studying, because with a smaller chunk of time, you can have a higher quality of study time versus the 12-hour study time, which tends to be wasted quite a bit. It's the old mantra is definitely true. The more time you have, the more time you waste. And so generally speaking, 2 to 4 hours most days is sufficient to get through the content. Practice questions, we will do this as a part of the class. Like I say, you have access to 6 exams. Plus, every time we meet, we'll go through a set of practice questions together, because evidence-based strategies, this is the most evidence-based way to study for a test, is to take quality practice questions in a low-stakes environment so you can learn the content. Learn the content, learn the content. Frequent low-stakes quizzing, variability in your subject matter. And so this will become more important as we get to like the last month before test day. You'll want to start varying the content you're looking at so that you are reviewing new stuff as well as reviewing old stuff. And that's what's called distributed practice. And I'll talk more about that on, I think I've got that coming up. Well, I have some recorded modules on that as a part of the VIP program. It'll take you through all of my study strategies, but we'll also talk a little bit about that on Thursday as well when we go through practice questions. But distributing your practice looks something like this, where you learn content on day 1. So this is day 1. On day 2, you spend a few minutes reviewing what you looked at the previous day. And then you go through this again. And a few days later, you look at material number 1 again, whatever that material is. You look at it and you frequently come back to it so that it doesn't disappear. The big mistake I see people make is that they'll spend all their time on, they'll say, okay, week 1, MSK, week 2, neuromuscular, and so on and so forth. But what they'll do is they won't look back at all at MSK until they come back around the loop like 8 weeks later and they've forgotten everything they learned. So that's why I say you've got to distribute your practice. And this is actually a motor control principle as well, that when you have distributed practice, which means the rest time is greater than the practice time, that is best for long-term motor learning, but also long-term memory. As far as what doesn't work, I get this all the time. Will, I read O'Sullivan from cover to cover. Like, no joke. I've had people send me this. They'll say, Will, I read O'Sullivan from cover to cover, front to back, and I still failed the test. What went wrong? Like, well, hard to remember things if you just see them on the page. That's why you have to work with them. You have to be very active in your learning style. So that active learning style, that's what the workbook is meant to do, is to help you put things into your own words. Bullet points, flashcards are very helpful. anything to put it inside your long-term memory banks. And again, in the VIP class, you'll see some modules about long-term memory aids. I have a whole series on how to make content stick long-term, because that's what you need for the test. You need to have content long-term in your brain so that you can pass, not just pass tests, but actually know the content. So as you know the content, you'll be able to practice as a more effective PT. So high density, high yield studying, we already talked about distributed practice, randomized practice, practice testing, high density, high yield studying. That's where you avoid distractions. You study in a place where you're very awake. Again, I talk about this in those study videos. Be sure to study with a goal. What topic are you going to master today? What are you going to master? Make sure that you are clearly understanding something so that you are, I like to consider this the Will Crane test. Could you, when you finished your studying and had closed your books, if I were to call you right then and say, hey, what did you just learn? Could you explain in your own words what you just learned? If yes, then that means you learned it. If not, need to revise or do more a different way. And then the other big thing here is make sure to take care of yourself. Taking care of yourself just means that you're getting adequate exercise, sleep time, outdoor time, especially the summer months. Just take good care of yourself, because we tend to avoid things we hate doing. And so if you really dislike studying, you will tend to avoid it at all costs. So try to make it as pleasant as possible. All right, so we talked about all of that. Let's see. So as far as the plan goes, just the plan going forward here, make sure to map out your time. So each week you will have, so like next week is musculoskeletal, go from Monday to Monday. If you've got more time on Thursdays and less time on Tuesdays, make sure to plan in your mind. You could even put it on a calendar, say that this day I'm going to work on this content, and on this day I won't have as much time, so I won't work on as much. And you just work on the available time with your target material. And like I had a student that described it this way: they were putting chunks of material into their available schedule. And as they did that, they found that they were using their time very wisely, because they had a plan. Every time you have a plan, you tend to make better use of your time. And then we talked about these frequently review from previous study sessions. That's that distributed practice, distributed practice, and then study with a goal to master the content. Rather than just see it, try to become the master of it. And if you can do that, then that will really, that's really going to improve and level up your studies in a serious way. All right, other common questions, and this is a great time if you've got questions. I see a couple questions that we've got to talk through here, but just some common questions. How much time should I have? 2 to 4 hours, which should take you through a couple of subsections of the workbook each day. What exam should I take first? If you do have the PETs available, take a PET early, and then take a PET as one of your last tests. The reason I say that is because the PET, the Practice Examination and Assessment Tool from FSBPT, this is one of them is no joke, a retired NPTE, meaning that I could have gotten my license by taking, from that test. So it's as real as it gets, those PET exams. So if you do have them, I recommend take one early and take one late or as your last exam. That way you can track your progress. It's a great way to start and finish your practice tests. If you have a question, the Telegram app or email, great way to get in contact with us. And my job, as far as what I've got to do, is to over-deliver. So really everything about this class is dependent on you passing the test. So that's what I gear these sessions towards. Every time we get together, I want to get you 3 or 4 more questions or 5 or 10 more questions correct on test day, because we talk about content that is easily tested, likely to be tested, and it's important for you as a new PT to know in your entry-level practice. So if you do have any questions, you can reach out to me directly, either on Telegram with a private message there, or you can email me directly, either admin or will@ptfinalexam.com. We'll get you there. So, all right. With that, let's go through a couple of questions. So a couple of questions. Sonia says, so by next Monday, we should be done with the musculoskeletal. We will begin on Monday. So what is today? Tuesday. So 6 days from now, we will officially begin the musculoskeletal section. By the following Monday, so if I were to, let me pull up my calendar here. If we were to look at just calendar dates. So you would begin the musculoskeletal section on the 15th, the start of musculo week, and conclude it by the 22nd, which would be the start of the neuro week. So, and that's not to say you couldn't work on it this week. Like, don't get me wrong. If you, in fact, I would encourage you to work ahead and get as much as you can done now, because you'll find that the more you do now, the less you have to do later. I mean, not that that's any great revelation, but it does very much help to get a jump start on these things as well. All right, so let me answer. I do have a couple of practice questions for you, but before we do those, let me just answer a couple of these questions. Question comes up, personal question, I guess, but I have an issue with venous blood flow in my legs, so prolonged sitting bothers it, but I don't think this is a disability as defined by the Americans with Disability Act, the ADA. How do I deal with this for the 5-hour exam? Can I be allowed to take more breaks? Is this something I can bring up to FSBPT for special consideration? So when it comes to formal, we'll say formal accommodations, I highly recommend you get them if you need them. So for instance, if you've required accommodations in the past in any way, whether it's for anxiety, some physical, diabetes, I mean, you name it. If you have required it in the past, I recommend you get the accommodations set up so you can be ready for the test. You can have a similar accommodation for your test. That being said, there are a lot of accommodations, or a lot of issues that are not worthy of formal accommodations. My guess is this probably wouldn't fit on that list of requiring formal accommodations. So for venous blood flow, I think this is the PT in me talking now, as I think about, okay, how do we prompt blood flow? Well, number one, you can do ankle pumps. I mean, that's certainly high on the list. But as far as a prolonged test, it may be that you'll have to plan on taking an unscheduled break. So between section 3 and 4, 4 and 5, something to stand up and walk around. Now that means you'll have to work pretty quickly through the first sections so that you have extra time. So it really becomes a strategy on your part during the first sections of the test to keep a very steady pace, so you have adequate time to accommodate that in the last sections. But if you do have some medical documentation of it, then you can absolutely apply for accommodations. I've seen people get them for things like that. The biggest thing is you have to be able to provide some type of medical documentation of that. So if you've got it, I say go ahead and do it. I see Sam. Good to have you, Sam. We just chatted last week. Sam, if the university has partnered with you, is this different than the VIP course, such as the syllabus of our specific course purchase? So the university courses, and so Sam, this is what you're a part of. So our university course gets the basic modules for the crash course and then the main systems on the test. The VIP course, that's where you get 2-a-week sessions with me, as well as additional video content for all of the systems. So the university courses, you'll get the practice exams. So you got those, and you get the crash course, you got those. The thing you don't get would be the practice questions that we do together. You wouldn't get our live sessions. You wouldn't get our full video library for the VIP class, and you wouldn't get the one-on-one calls. So, but you get the same workbook. So you get the same workbook. In fact, I just gave it to you last week. You get the same workbook, very similar study plan. It's just how much live time you get is really what it boils down to. Sam says, how many days approximately do they take to get back on your accommodations? That unfortunately is highly dependent on the state where you applied, because it's the state that has to communicate with FSBPT about the accommodation. And unfortunately, it's one of those 4 to 6 weeks kind of a thing. Sometimes it's very fast, sometimes it's slow. So therefore, the earlier, the better on accommodations. Absolutely, the earlier, the better. And then another question here. Will, I got the practice exam bundle and gave the exam over the past few weeks. Here are my scores: 122 out of 200, 125 out of 200, 127. Any tips or strategies that I should improve? Definitely content related. And that's what we'll do as a part of the class. We'll go over content. Other strategies would be just to, and we'll talk about this on Thursday, our practice questions. Be very logical and methodical in your practice questions, so that as you take them, you are going through a very, very logical and sequential method, going through the sequence of answering the question. And the more you can do that, we'll call it through muscle memory or mind memory, that you just automatically, you look through the question, you look for the keywords, you go through each answer option, either ruling it in or out. All those steps, you just need to make sure that that's a very automatic process. Jennifer says, I already bought the 6 exams. I'd like to get the study workbook as well. What are my options? Yeah, just you can send me a message, admin@ptfinalexam.com, and I can get that shipped to you. It's, like I said, $35. And that's really legit just my cost of printing and shipping. It's really, yeah, $35 is barely break even on those. But it's fun. It's really nice to have the printed copy. And so that's why I keep a stack of them here. And I know that if maybe I'm just old school, but I really like pen on paper. It sticks with me a lot better when I do that. All right, so let us now talk about, and certainly we can talk about more questions you have, but while you're thinking up your questions for me, let's go ahead and do a couple of practice questions here together. This will be fun. We'll go through a couple of practice questions. So let me see if I can cue this up. Stand by. I'll get this one ready. Okay, so our first question, we're going to roll this out. I'll give you about a minute on this. I will be quiet while you respond. And I'll give you about a minute. Ready, set, and go. All right, just a few more moments. All right, and time. So this one, while examining a child with muscular torticollis, which of the following cranial nerves is most likely to be implicated as the cause of the torticollis? Now, those of you looking at this, you're probably saying, well, I know the sternocleidomastoid is the muscle that's involved with torticollis, and that's innervated by cranial nerve number 11, but I don't see that as an answer option. So suddenly you're like, oh dear. So it's not cranial nerve 11. What is it? One of the key causes of torticollis would be double vision or visual skewing. So if your eyeball is not lining up, if you're not able to focus very well. So cranial nerve 3 is the only visual or eye-related cranial nerve here. So the oculomotor nerve, any type of double vision or skew deviation from cranial nerves number 3, 4, and 6, or if they had some difficulty like double vision with being unable to view or perceive the visual stimulus or to be able to see, and that would implicate cranial nerve 2. Any of this, any double vision or skew deviation is likely to cause torticollis because they'll have their head turned in order to accommodate their vision. So therefore, the most likely case here would be cranial nerve 3 of these answer options. Cranial nerve 5, it's related to the muscles of mastication and in the sensory of the face, but not, I mean, it is the sensory of the eye cornea, but it's not the sensory as far as visual acuity goes. Cranial nerve 7, those are the muscles of facial expression. Again, unlikely to be related to torticollis. And finally, cranial nerve 9, glossopharyngealis is where it's part of the gag reflex. It's part of swallowing. So it's, again, the least likely to be associated with torticollis. Whereas cranial nerve 11, possibly, but more likely than not, it would be one of the visual cranial nerves. So cranial nerve 3, there's 2, 3, 4, 6. The optic, oculomotor, trochlear, and abducens nerve, those are the ones likely to be implicated here. And in fact, in our Neuro Week, we'll talk all about the cranial nerves. I've got all the stuff that you need on cranial nerves, about what they do and how they like to ask questions about those. And this is a fun, unfun one about cranial nerves. All right, let's do one more. Or no, see, I've got two more queued up. Let's go ahead and do two more. We're doing good on time. Let's go ahead and rock this out. So give me about another minute on this. I'll be quiet while you respond. Ready, set, and go. All right, just another few moments. All right, end time. So this one, a patient sustained a midshaft humeral fracture 8 weeks ago and is receiving PT for upper extremity strengthening as a result of nerve damage due to the fracture. Which of the following muscles is least likely to have impaired strength? So two-step question. You have to understand the midshaft humeral fracture that is most likely to damage what? Most likely to damage the radial nerve. And so of these muscles listed, which one of these are not innervated by the radial nerve? So we know that the radial nerve, it's a beast, right? A beast. A-S-T, right out of room. But the abductor pollicis longus, brachioradialis, the extensors, anconeus, supinator, and triceps, these are all innervated by the radial nerve. So brachioradialis, the way I remember this, word radial is in brachioradialis. So that one's likely to be affected. This is the least likely question. The supinator, also innervated by the radial nerve, and the anconeus, also innervated by the radial nerve, leaving us only with flexor pollicis longus, innervated by the median nerve. Excellent. And so we'll talk about these acronyms more when we go through the upper extremity. In fact, I've got them for most of your primary nerve roots. I've got them for some of the lower extremities. We've got a couple of fun ways to remember for myotomes. So we try to make things not just talk about the content, but ways to remember the content, and we try to incorporate that into everything we do as well. All right. So let's see. Sonia says, why would you choose radial as opposed to median or ulnar? So the radial nerve, if you recall anatomically, the radial nerve it goes through the radial groove of the humerus. And so the most likely nerve damage from a midshaft humeral fracture will be the radial nerve. It'll be a traction injury or even a total shear injury because that radial nerve is right on the humerus, like touching the humerus. There's a groove in the humerus for the radial nerve. And so the nerve most likely to be injured would be that radial nerve. I suppose it is technically possible that you could have such a severe fracture, you could damage the ulnar or the median nerve. But again, this is one of those cases of least likely. We know that humeral fractures are associated with radial nerve injuries. And so therefore, armed with that knowledge, it makes it pretty clear that in this case, barring any other information, that's what you have to really hone in on, is that it's going to be the radial nerve, and then identify the radial nerve muscles. Good. All right, last question here. And then the other thing, I'm going to post over in the chat box the link if you want to order a physical copy of the workbook. I had a couple of people already request me. So that's the direct link, and it's just where you enter your shipping information. And anyway, so if you want to grab that, I'll post that over in the Telegram group or via email, whatever you need. So last question here. Give you about a minute on this. I'll be quiet while you answer. Ready, set, and go. All right, just a few more moments. So this is probably one of those very frustrating questions that if you don't know what neuralgia paresthetica is, then it leaves you, if you're like me, just scratching your head saying, what in the world? So maybe the only little clue there is that neuralgia would be like pain, and paresthetic, you have paresthesias, so painful paresthesias. Now, anytime you think about paresthesias, we typically don't associate paresthesia with the back. So sensory disturbances on the back, I mean, I guess possibly lateral back, but usually not. And so you're left with the lower extremity. So where is it? The medial thigh or the lateral thigh? Well, again, just by nature of what the most likely case for an injury, it's probably going to affect the lateral thigh more than the medial thigh. All that to say, neuralgia paresthetica is a specific condition of paresthesias caused by compression of the lateral cutaneous femoral nerve. And so that LCFN, it creates neuralgia paresthetica. It's where you get the numbness and tingling over the anterolateral aspect of the thigh. It's worsened with tight clothing or excessive walking. So I've experienced this before, where if your belt's too tight or if you're standing and walking for way too long every day, then what happens is you can get the paresthesias down the lateral thigh. So that is the definition of neuralgia paresthetica. And unfortunately, one of these types of questions where it's hard to guess the correct answer. And so I get that question all the time, like, Will, if I don't know the answer, how do I still answer it correctly? And I keep alluding to it, but on Thursday, we'll talk through a few of those strategies. But the biggest thing is to try to be as logical as you can about each one. Say, well, paresthesias, I see that in the word. I think about paresthesias, just the automatic association in my mind of paresthesias is in the upper or lower extremity. So it's probably not the back. That'll lead you at least 50-50. And then from 50-50, you have to consider what is the most likely case, or where have you heard about it the most? And this is where your gut intuition can be very helpful as well. Excellent. All right. So with that is the last question I have for you. Let me go ahead and polish up. I had a question here. Brittany says, any advice on when taking a practice test and getting stuck between two answer choices? This is something I struggled with on the majority of questions when I took the April exam. Yeah, so Brittany, not to kick the can down to Thursday too much, because we will talk about this, but the kind of the short answer to this is that as you look at two answer options that you feel like they're both correct, the next step would be to ask, all right, would I do one of these first and one of these second? Or another way to consider it is, does one of them have a safety consideration? So you've got safety consideration, the order of operations or the effectiveness. And then the last one is, how direct is it? Meaning, is the thing that I am thinking about directly associated with this, or is it just a roundabout association? So safe, direct, and effective. And most of the time, those three things will get you really close. Safe, direct, effective. Sometimes you have to consider all the stakeholders, like what is the best for the PT and the patient, or the PT, the patient, and the payer source, the insurance provider. So you have to consider the three stakeholders and what is best for all those. That's key for professional responsibilities, but that's those are some of the considerations to have when you narrow it down to two. The final thing is just to look for order of operations, safety, effectiveness, and then maybe the last thing to look at and say, which one, if my clinical instructor or the most reasonable PT was here with me right now, what would they say? And it's kind of this third party mindset you have to gain. Is like, well, not what would I say? What would someone who knows what they're doing say? Which is you, but just a little mental exercise to stay sharp on that. All right. So that was that question. All right. Any other questions or concerns about anything we've talked about today? Sam says, could you reiterate the one-on-one power calls? So the way the power calls work is that I've got a Calendly link on our VIP page. You just go to that and you'll see the schedule for the power calls, and you'll say, all right, it looks like I can do, this date at 10 a.m. or 10:30 a.m., whatever works. And you go in and you schedule your power call. It's a half-hour slot, and you can schedule one or two of those as you wish. Just go ahead and schedule one or two. In fact, I have people who say, I know I need one now, and I'm for sure we'll need one next month. So I'll just go ahead and schedule the two of them. And then at the power call time, we can do it. Most of the time it's via telephone. So I just call you at the number you provide, but we can also do it via Zoom if you've got some things you want to like do screen sharing on and talk about specifically. But it really is meant to be like a tutoring call where you have a question. I'll do my best we can talk through the answer, talk through some strategies of finding the answer. And one of the advantages I have, again, I know maybe it sounds silly to say things like this, is that I've been asked a lot of questions in the 11 years doing this, and I'll still get questions I don't know the answer to. There's no doubt. But I've got a lot of questions I've been asked before, and so it can be very helpful just to talk through things. So that's the one-on-one power calls. Again, those are meant to be like a tutoring session, like an office hours session with one of your professors. That's how I like to make it feel. Except awesome. I want it to be awesome. Good. Any other questions or concerns while you've got me? So like I say, I do like to post the recordings of these. Depending on Zoom, I should be able to get the recording up within the first hour. Sometimes Zoom is a little slow, and so it takes me 12 to 24, just depending on, like, if it doesn't come out until midnight or something, where it's Zoom servers. Most of the time they're great, but sometimes they can get hammered, and you just have to wait on those. But generally speaking, I try to get these recordings posted ASAP. Plus, we've got a full video library you can go through, practice questions. We try to go through as much as we can. Proven, compassionate, effective. That's what we've been doing. That's often imitated, but never equaled. That's what we do over here at PT Final Exam. All right. As we conclude then, just a quick thank you to all of you who are VIP members. If you're not yet and you have questions, please feel free to reach out. I think you'll really enjoy it. In the meantime, I'll see you again on Thursday for sure for our practice question session, and we'll talk about practice questions. Anna says, how long before the exam do you recommend taking the PEAT? So your last practice exam should be about 2 weeks or so before the test. That way you have adequate time to review it. So just off the cuff, I mean, we can look at the calendar, but it would likely be around July 10th would be when you take your final PEAT exam, or really any practice exam, just so you have adequate time to review it. And then after that, after you take that PEAT or full practice exam, the last 2 weeks before test day should be just small sets of questions. So like 5 at a time, 20 at a time, something in very small sets. Question says, is there a limit to the number of people in the VIP course? There's not a hard limit, but generally speaking, we have about 30 to 40 people in there, which is, it means that I can answer every question. I can talk to every person and generally get to know everyone's names by the time we go through that. So the VIP program is meant to be a smaller group. Now, granted, it would be a good problem to have, but if I had like 300 people that signed up for the VIP program, we would then add more small group sessions. We'd try to make it would keep its small group feel. And we have had to do that before. Anyway, story for a different time, but all right. Any other questions for me while you've got me? If you look at the slide deck down the bottom, I won't really talk too much about these, but these are like, this is what the score reports look like after a failed attempt. So I've got a few of these failed attempts that you can see. I tried to blank out any really identifying information. You can see the state and their ID number, but that's about it. Just take a look at these and you'll see that, okay, this is how they score it. It's based on the content outline. You see that it's based on the body system. Like over here, we see the body systems. We see that it goes through the big systems. You can see that if you were to look at this score, you'd see the total. So the total indicating the number of items correct. They scored 128 correct. And then the on track to pass, I think it's funny they don't populate this box, but really this box is just the sum of all these boxes. And so when you look at all those, I'm just going to add this up while we're here in real time. 34 plus 42 plus 40 plus 19, 135. So to pass this form of the test, you had to get 135 correct in order to pass this form of the test. And it is slightly variable. That's why they have the scale scores, because of the variability between test forms. So yeah, take a look at those. Again, not a whole lot to glean from these other than just point out the This is how the grading is done. This is what they look at. Like this one and this person, their section scores. Section 1 was just the pits here. We see that section 1, they only scored 20 items correct versus like section 3, they got 30 items correct. So you want to make sure that your section 1 is strong, your section 5 is strong. Yeah. Let's see. Sonia says, I had to do my schooling over 7 years ago, so it has been a while since I did neuro and cardio. Feel strong on MSK. Do you think I should review all of my past lectures on neuro and cardio, or should I focus more on your modules? I would love it if we could do both. So certainly the content you were previously accustomed to would be good. I would probably prioritize my content first, and really just because I try to be as targeted as I can. It's not the full scope, rather it's what you'll be tested on. Start with that and then follow it up with your school modules. That's what I would recommend. Ben says, regarding the scoring on the exam, do you have to get a certain amount right in each section, or is it purely cumulative? It is purely cumulative. So if we go down here to scoring, you'll see that it really is totally based on the total items correct. So this person scored a 582, 128 items correct. So, and you can see they did great in integumentary, but did poorly in cardiopulm. So everything kind of offsets. You don't have to pass every section to pass the test. You just have to cumulatively exceed the threshold. So that's a good question. Very good question. Justin says, is there an example of an ideal study schedule posted on the dashboard? I do have one, and I will post it to the dashboard. Yes. Short answer is yes. An ideal study schedule for each day. It has a distributed schedule, goes through the workbook pages, and then pushes you back to previous sections each week so that you can stay sharp on everything you've already studied. So yes, I will post that. I'll put that on the workbook page, and yeah, I'll put it there. So you'll be able to find an ideal study schedule for the workbook. A great question, by the way. Really good question. All right. Okay. Any other questions, burning questions while you've got me? I want to make sure you have time to click them in so that you're not frantically rushing. But in any case, if you do have questions along the way, you can always access me via that private Telegram group, or you can email me directly, and I'll be happy to help along the way. Again, my job is to over deliver and get you through the test day. That's really all that matters to me, is getting you through the test. So that'll be fabulous. Okay. Well, thank you for your participation. As always, I'll see you again on Thursday. We'll do another one of these sessions, and we'll go through practice questions and how to identify and have a good logical process going through practice questions. We'll do some practice together. I think you'll enjoy that. So until then, I'll get this recording posted to our VIP dashboard, and I'll catch you again on Thursday. Stay safe out there. Will Crane fist pumps all around, and I'll talk to you soon. Thanks.